Good morning, it's Dr. Hodges. I remembered my selfie stick today. So today I want to talk about the vitamin zinc. Well, I guess it's not really a vitamin. It is a mineral, micronutrient that we follow for our bariatric patients. You know, every bariatric patient, and really most people as a general rule of thumb, need to make sure that they're taking their vitamins every day. And I know that bariatric patients, you always think of the big ones like B12, calcium, iron, but there are also some minerals that you really need to have as a weight loss surgery patient to ensure that things are moving along and going well for you. And zinc is one of those minerals. For a bariatric patient, typically you need to make sure that your vitamin will have about 8 to 22 milligrams of zinc a day. But why is this important? So zinc is a mineral that works in many different processes in the body. It works for cellular function, cellular turnover. It actually is part of the whole cell growth mechanism. There's also, it has some immunologic functions. So there's definitely some immunity support. We've also found that there's been some research to show how it can improve certain eye diseases as well. So what exactly, when I say cellular function, does it do? So when you take your zinc, it is absorbed in your small intestine. And usually zinc is found in protein-based products. So it's found in most red meats, chicken, turkey, things like that. There are also some vegetarian sources of zinc. However, if you are a vegetarian or vegan, it is important that you're supplementing your diet with extra zinc, because those are not the prime sources of zinc. And you certainly can get a deficiency if you don't have enough in your diet. So zinc is important for cell growth, so making new tissues, for wound healing. And so what are some of the things that will happen if your zinc isn't too high? So I think the two biggies that I will hear is, I have a patient that comes in my office and they tell me, I'm so tired. Or this is one that everybody talks about after weight loss surgery. Dr. Hodges, I'm having hair loss. So that's whenever I had to put my thinking cap on and say, okay, what are some potential sources? The two biggies are always going to be lack of protein and anemia from iron. But did you realize that low zinc can also cause hair loss, brittle nails? It can actually cause poor wound healing. So patients that have chronic wounds, particularly like if you're diabetic, and you have one of these open sores, and it's just not healing, one of the things that physicians always need to do is check your zinc level to ensure that it's where it needs to be. If not, you certainly need to be supplementing, because that certainly will help with wound healing. Patients can also have some, now this would be in more severe cases, can have issues with confusion. It has certainly also been linked with eye disease, and so there have been some reports that it can help if somebody has age-related macular degeneration. So what is that? That is a disease of the eye that affects your whole visual field and what you can and can't see, and it can be just a normal during the normal process of aging, and taking a supplement for zinc can help retard that process, so keep that from happening. So whenever I have a patient that comes in, and like I said, they're coming in, they have hair loss, I'm always going to check not just their regular lab work, but I'll also check for their zinc levels. I think the other main thing that zinc is known for is for your immunologic support. So there are a lot of case studies that are showing that if you take zinc within 1 to 3 days of having symptoms from the common cold, you can certainly shorten those symptoms. There's actually some really good brands. I'll put the links in them in the notes. I actually will take Zicam. They have a couple of different forms of it. It's going to be in the aisle where they have like emergency and all kind of those homeopathic remedies. Woo, just 1 second. There's a lot of yard work. Okay, so the one that I really like is Zicam. You can find it in kind of the homeopathic aisle. They have a couple of different forms. They have one where you can squirt it in your mouth. They also have a little swab that you can swab in your nasal cavity. Not too fond of sticking any little swab up my nose. So typically what I'll do is, if I know whenever it becomes flu and cold season, I'll just keep it in my purse or in my bag at work. And I almost use it like Banaka mouth spray. I give myself a couple of squirts several times a day. They also have some zinc lozenges. For my bariatric patients, when their zinc is low, you can also take Bariatric Advantage. Has a really good zinc, and it doesn't cause a lot of GI upset. So in the past, before I found the Zicam, I'd gone to the grocery store and I just got on the vitamin aisle zinc. I went ahead and I picked that up and I took it, and oh my gosh, I would get so nauseated within like 20-30 minutes. And so I just didn't want to take it. It was also, even though it was a pill, it was like real chalky. And so I just didn't want to take it. However, if you want to have a little boost in your immune function, especially if, like I said, if you're having a cold or you've been exposed to people with the cold, or if you do find that you're having some hair loss, one of the things that you can do is go to Bariatric Advantage and get their zinc. Their zinc is really good, and it doesn't cause any GI upset. I think that that's the main thing, because who wants to take a vitamin if it's making you feel lousy? The whole purpose of the vitamin is to not make you feel bad. So you're probably not going to take it if it makes you feel poorly. But I just want to kind of end this with, it's really important that everybody, whether you're a weight loss surgery patient or not, that you really are working on your health every day. Take your vitamins every day. If you haven't had weight loss surgery and you're just on a medical weight loss program, or if you're on a maintenance program, make sure you're taking a daily multivitamin, because more often than not, we just don't have a complete diet. And certainly if you are on a plant-based diet, you really need to make sure that you're supplementing with some of these extra nutrients and some of these extra minerals, because you won't get them in your regular diet if it's just purely plant-based. So bariatric patients, remember, 8 to 22 milligrams. Make sure you have it. Centrum's also a really good one. Centrum from A to Zinc. They're not lying. So hope that this helped.